because your brain controls a lot of different things. And depending where that overactivation and abnormal activity is coming from is what the seizure is going to look like. So people can have seizures where they fall to the floor, they have the shaking of the extremities, but people can also have seizures where they just have a blank stare, they're looking ahead, and they're just unresponsive, and that's a seizure as well.
Welcome to Healthy Living, Wellness and Prevention, Medical Innovation, the informed side of care. Welcome to Baptist Health Talk.
I'm your host, Willard Shepard. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending topics. Today, we're talking about epilepsy, recognizing the early signs, managing symptoms, and navigating the journey. We're joined by Dr. Louis Tornes, neurologist and director of the epilepsy program at Baptist Health Miami Neuroscience Institute, and Dr. Pooja Patel, neurologist and director of the epilepsy monitoring unit at Marcus Neuroscience Institute, part of Baptist Health. Doctors, thank you both for being with us today. And first, I'll start out with you. Define for us really what is epilepsy? What does it look like? And are more people at risk than we commonly think?
Sure. And again, thanks for having us today to join you for this discussion. So I think it's a great question and something that I think a lot of confusion's out there for more of the lay people outside of the medical world. And I think one of the things that really confuses people is the distinction between seizures and epilepsy. There's a little bit of a confusion of, what's one versus the other. And the way I like to look at it for kind of a basic way is if you have seizures, that doesn't necessarily mean you have epilepsy. But if you have epilepsy, you do have seizures. So what basically epilepsy is a recurrence of seizures. In the medical field, the technical kind of numbers that we're looking at is a greater than 60% chance of you having seizures down the road. So people with epilepsy have seizures that continue to occur down the road. And there are a lot of factors that can cause you to have epilepsy, and it kind of varies on your age. Children have different factors. Sometimes they have more genetic factors, congenital things where an adult might necessarily not have. For adults, a lot of times it's more of a structural issue in the United States, maybe traumatic brain injuries, strokes, bleeds. Worldwide, there's also the neurologic infections as well, which we don't see as much in the United States. So there are a lot of things that can initially or lead you to have epilepsy.
What does a seizure look like?
Sure. So that's a good question because I think most people, when they think of a seizure, they think of the movies and they think the really big grand mal or the generalized tonic-clonic seizures. And that's not really what all seizures look like. So seizures can really look a variety of ways. And what really determines what a seizure looks like is where in the brain is the seizure coming from. Because your brain controls a lot of different things. And depending where that overactivation and abnormal activity is coming from is what the seizure is going to look like. So people can have seizures where they fall to the floor, they have the shaking of the extremities, but people can also have seizures where they just have a blank stare, they're looking ahead, and they're just unresponsive, and that's a seizure as well. So seizures can have a lot of different appearances. The thing that we as doctors and neurologists like to look at is the term that we call stereotype, which means that they always kind of look the same. They should always be the same when they occur. So if someone's having a seizure, it should always kind of look the same every time they have it, be it if they're having abnormal movement, so your arm could be moving uncontrollably, or you can be having kind of flashing lights in your vision. Sometimes people get a deja vu sensation, an intense sense of fear all of a sudden. So it can just really depend on where in the brain that it's coming from, but it can look a lot of different ways.
So now to that, Dr. Patel, how do we recognize this when this is happening with someone else or a person knows they've had this before, that this is coming on?
So to kind of get back to what Dr. Tornes was saying, the stereotypical nature. So patients themselves know if they're having the warning, it's going to be very similar every time they have it. So they will know based on that it's the same warning, I'm about to have a seizure. Most of the time, or a lot of times actually, there is no warning and it can just be a seizure where patients are not aware anything is happening because they've lost awareness or they've lost consciousness, and family members or whoever they're surrounded by can see this. So if it is close family or friends who have seen these seizures before, they will look exactly the same to them, whether it's one side of the body is shaking or it's just like a staring spell where they are unresponsive during the time, they stop doing what they're doing, but they're able to recognize because they've seen this before. When it's new onset, it is tough. It's tough for family or friends or anyone who's witnessing to recognize if it is a seizure or not.
Now, as to treatments, where are we today with helping people who have this in terms of medication? And I'm a big lifestyle person. I'm a person that has to watch out for cardiac uh, conditions in our family. So I'm diligent about the gym, diligent about my diet, taking my meds at the right time every day, those types of things. What about a person with epilepsy?
Yeah, so for treatment, really the cornerstone for treatment in epilepsy since the very start has been medications, and that still remains the cornerstone of treatment. So most patients, when they are diagnosed with epilepsy, are started on an anti-seizure medication, and the point of those are really to stop the seizures or lower the risk of them occurring. Most patients, when they're started on one medication, have around a 50% chance of getting seizure freedom. And the issue with the medications, while yes, they do work well, around one third of patients, no matter how many medications they're on, will continue to have seizures and will never be necessarily fully controlled or seizure free. So in those cases, we do have other options, and really that looks more like a surgery. So surgery, be it a resective surgery where they go in and we kind of remove that area of the brain where the seizures are coming from, or an ablation, which is we kind of go in and then we burn that area of where the seizures are coming from, can actually give the patient seizure freedom. And that's usually what we do for patients who what we consider drug-resistant epilepsy, which means you're on two medications and you're still having seizures occur. Because the goal is really for you to never have any seizures. That's what we want. So we have multiple options. And now there's more developments in the field where we have these new devices called neuromodulators. And those are devices that kind of like, if you can think of them for someone who's not familiar with neurology, is a pacemaker for your heart. They're basically electronic devices that are sending an impulse to your brain to kind of disrupt that abnormal circuit that's causing you to have seizures. So that's another option we have now kind of in our arsenal to treat patients with epilepsy. And with regards to lifestyle, I also think lifestyle is a really important one. Even if there's not huge benefits that you can get from reducing seizures, it does play a role, and it plays a role also in your overall health, which is really important. So making sure you're sleeping a good amount. Not sleeping could definitely cause you to have seizures if you have epilepsy. Also making sure you're staying fit and healthy, staying hydrated, eating well, avoiding drugs, illicit drugs, also avoiding alcohol if possible. Those are all things that you can do to decrease the risk of having seizures once you have that diagnosis of epilepsy.
So, big picture, if you're doing those kinds of things that you all tell us to certainly do about exercise and diet and eating the right things, if you're in good overall physical health, it opens the door for you to be able to do more treatments. And do you think that they can be more effective just because a person's in better physical condition?
Yeah, for sure. For a person that has a diagnosis of epilepsy, being healthier makes it easier for us because a lot of these medications that we use sometimes are contraindicated if you do have these heart conditions, as you were saying. If a patient has heart condition, our kind of choices on medications are limited. If you're on other medications for other medical conditions, sometimes they have interactions, and that again limits the options that we have. So if we have someone who comes into us and only has epilepsy, very healthy, has no other medical issues, then we can pretty much do whatever we think is best for that patient. We don't have to have those limitations of, oh, well, you have this condition, you have this medical issue, this medication, I can't give you this, even though I think it might be the best choice for you. So the healthier you are, the easier it makes it for us as well. And if, say, you're one of those patients who does have to go to surgery, if you're a healthy person, that's going to be better for us because we have less concerns of, can you tolerate the surgery? Would you come out successful from the surgery? So being healthy for sure is going to be better overall. And as one of the other things for people with epilepsy, there's a lot of comorbidity with psychiatric conditions, especially anxiety and depression. Patients with epilepsy do have a lot of anxiety and depression. So being healthy, exercising, sleeping well, eating well have been shown to help with those conditions. It could also help the overall health of the patient.
Dr. Patel, what about a person who has this that you are treating? What impact does this have on their daily life?
So, seizures, if they're left untreated, can be very dangerous because if a generalized tonic-clonic seizure occurs, it can cause trauma. It can cause difficulty with breathing, choking, aspiration. Even with focal seizures, it can eventually, if it's untreated or poorly treated, can lead to memory impairment, psychiatric illness, like we talked about, anxiety, depression becomes part of it. So if left untreated, it can be very dangerous. In terms of other impact that it causes in daily life is that if it's uncontrolled seizures, it restricts their driving. So patients who have epilepsy and their seizures are not controlled, they can't drive. That's a big burden, especially here in South Florida, where public transportation is available, but not as great. And patients, it's affecting their daily life, such as work, school, family life. Other things it can also do is with younger patients, we see that a lot of times having this diagnosis can impact their life, talking to their friends about it, or school, teachers, anyone knowing about it can impact their life negatively as well.
I imagine it's frightening in a sense of if a person has an orthopedic injury, they tear their ACL, they go through their rehab, they do their strength and conditioning program, and the orthopedic surgeon may say, okay, look, it's probably not a good idea to continue running on the pavement, take up cycling. But in this, it just appears to me that, and I think most lay people, that, wow, this could happen to me at any time. Can you address that part of this, please?
Sure. So, just like you said, the unpredictable nature of seizure, I think it is one of the most disabling things because it can occur anywhere, anytime, no matter what you're doing, with or without a warning. Most of the time, without a warning, but even if they get a warning, it is very brief that they might not be able to get to a safe place. So, it restricts a lot of things they're doing, such as like being in a water body. It's dangerous if you were to have a seizure, being on a ladder, operating any machineries. So it restricts the type of work they can do or even being able to function in their day-to-day life.
What about age? As a person ages, what impact does that have, if any?
Yeah, so for most times, epilepsy, if someone's diagnosed with, say, a focal epilepsy, as you age, there isn't much that's going to change. Sometimes it can even get better with further advancements in treatment and options like if you go down for surgery and we can get you seizure freedom that way. There are those some conditions because it really depends on what type of epilepsy do you have. Because there are some other conditions that are associated with epilepsy and seizures. There's some neurodegenerative conditions, dementias that can be associated with seizures and epilepsy. And sometimes you could see in those patients, if that's the cause of their epilepsy and seizures, as their neurodegenerative disease progresses, you can see a progression of their epilepsy and seizures. But for the most part, for a patient who has, say, seizures, they have focal epilepsy secondary to some kind of scarring in their brain, those don't usually tend to get worse as they age. The only times that sometimes you could see that would be some people will notice a kind of what we call a honeymoon period with some medications that you take the medications initially and they work really well, but over time your body kind of gets normalized to it and then it stops working. So sometimes that can happen. But for the most part, as you age, your epilepsy shouldn't really be getting worse, again, unless it's secondary to a neurodegenerative condition, a condition that's kind of deteriorating in its own right, and your epilepsy is getting worse because of it.
Dr. Patel, what can happen if this goes untreated?
So if it goes untreated, there are a lot of comorbidities that can be associated with it, such as epilepsy long term can cause some of the psychiatric illness that we talked about. Anxiety, depression comes as part of it, memory impairment. So especially focal seizures are occurring in an area of a brain which controls your memory or language. Ultimately, if it's not controlled, there's going to be scarring in that part of the brain that can lead to decline in those functions. So memory impairment, even sometimes language impairment, even if it's intermittent. So other things that it can bring is also long-term chronic epilepsy. If it's poorly treated, can increase the risk of SUDEP, which is sudden unexpected death in epilepsy.
Now, once you have determined what's the best treatment for one of your patients, how do you keep this under control and monitor this and have them be a success long-term?
So for new onset seizures, it's very important to seek emergent medical attention because you want to rule out secondary causes. You want to make sure there's not something structural abnormality in your brain that's causing this to happen. So seeking emergent medical attention would be number one thing. After that, establishing care with a neurologist, preferably epileptologist, to manage this chronic condition. Some of the options we went over, like anti-seizure medications. And if you don't have success with anti-seizure medication, looking at other surgical options would be the next step. From a patient standpoint, what they can do would be to make sure they're avoiding the triggers as best as possible, such as sleep deprivation, alcohol, drugs, making sure they're compliant with their medications and taking it regularly.
What should a person do if they see some warning signs that I need to come and see you?
Yeah, so as Dr. Patel mentioned, if you're having a first-time seizure, you should immediately go seek emergency medical care. Because as she mentioned, one of the big concerns is, well, why are you having a seizure if you've never had one before? Because there could be a lot of causes for seizures. Some of them can be sometimes very emergent. If you have a bleed in your brain, stroke, a tumor that's causing swelling in your brain, that could cause you to have a seizure, and that's very concerning and you need immediate emergency care. So usually for people who are having the first-time seizure, they have to go seek emergency care right away. For people who have a known diagnosis of epilepsy and have seizures, a lot of times they also sometimes have to seek medical care, especially if they're having prolonged seizures. So seizures that are lasting a very long time and they're not coming back to their usual state. If they have, say, a small focal seizure and they come back to normal, and that's what their seizures usually are, but all of a sudden they're having one that's maybe becoming larger. It's not their typical seizure. It's lasting a very long time. In those cases, patients can be prescribed what we call rescue medications. Nowadays, we have a lot of options intranasally. You basically spray a medication into your nose to help stop the seizure emergently at the moment. It's going to be another person that's there with you that would spray it into your nose. But if they continue to seize, in those cases, you do have to call 911.
Okay. We didn't discuss this before, but we live in a world now where so many people are on their smartphones, they're on their computers, their iPads. Can that have any impact on this, or can it be an aid in any way for people who do have epilepsy?
So, in terms of an impact where it can affect their seizures, one of the things I can think of is like flashing lights. So if you're watching something or, suddenly it's more like a strobe light type of picture, that could, in some types of epilepsy, trigger a seizure. In terms of an aid, I think it's one of the biggest aid in this day and age because we often ask patients' family use their cell phone to take a video if patient's having a seizure. That gives us a great information when patients come in to see us. If we see a video, it gives us information type of seizure it could be, how long it's lasting, what are we seeing, are there some features that pinpoint to whether it's focal, generalized, things like that. So I think it can be very helpful, not just the description that the family is giving, but actually seeing the video or images of it.
You mentioned the family participation. What should a family member do, or any of us, when we see a person and we believe that this is taking place? What, if any, intervention should be done?
Yeah, so if you have a family member that's having a seizure, I think that's another thing that a lot of people see on movies and they think, oh, I have to put something in their mouth or they're going to swallow their tongue. What you really want to do is have them roll over to their side. So in case something, if they vomit, they're not going to swallow that. That's very dangerous. So you want to just roll them over to their side, make sure they're not around anything that they could hurt themselves with if they're kind of shaking. And that's it. You kind of, if the person continues to seize, then you want to call 911. If it's a long seizure, if it's their first time seizure, you want to also call 911. And what Dr. Patel had mentioned, if possible, if you're by yourself, it might be a little bit difficult, but taking a video of the event would also be very helpful for the epilepsy doctor or the neurologist when you go to follow up with them. It can give us a lot of information because a lot of times the patient isn't able to advocate for themselves because they're not going to recall the event. And the family member in that instance, as you can imagine, is very scared. They're anxious. They're kind of an adrenaline rush. So they might not actually notice these little fine details as a neurologist that we're looking for. So being able to take a video is also very helpful for us. But from the point of the safety of the patient, you want to roll them on their side, make sure they're not around any objects that they could hit to hurt them. If it's a prolonged seizure, call 911 for patients who have epilepsy. If it's a new first-time seizure, call 911 as well. And that's pretty much what you would want to do in those situations.
Okay. Final thoughts from you about where we've come from when you started your practice with this and where we are now.
So I think epilepsy is one of the fields where we've made a lot of advancements. The primary treatment being the anti-seizure medications. We see many new anti-seizure medications coming out, which not necessarily means they're more effective, but they have better side effect profiles, so better tolerance from patient standpoint. They've had success in being compliant with it because they're able to tolerate it better. We've also seen advancement in the surgical field as well because newer surgical techniques, newer surgical options have come out. Neurostimulation devices are a great tool these days to help patients that where we can't remove that part of the brain that's causing the seizure. So the advancements have happened and they're continuing. So it's very exciting treatment options available.
Doctor, your thoughts about that? I was fascinated when you mentioned what, in essence, is a pacemaker for a person who has electrical cardiac issues, something tantamount to that. Fascinating that the technology's come that far. What about on your side?
Yeah, I would agree. I think the biggest really advancement, there's always new medications coming out, and there are some medications that have been now are starting to come out that have a better maybe track record with helping these patients, as I mentioned earlier, that are on a lot of meds. And at that point, their really only option is surgery. There are a few, but for the most case, most medications, once you hit a certain amount of meds, once you're on 3 meds, most medications are going to really do the trick at that point. You're really going to have to get that surgical workup. And I think that's where we've had a lot of advancements. Not only the surgeries themselves, but really how we pinpoint where in your brain are the seizures coming from. That has been a lot of advancement in the United States recently with our techniques that we're using now and giving patients alternatives from medications to get seizure freedom. Because that's really what we want for the patient. Because as Dr. Patel had mentioned, not being able to drive, all these other quality of life factors that are really impacting someone with epilepsy that continue to have seizures, it plays a big role. So being able to provide them something that's going to provide seizure freedom, I think is a huge, huge benefit. So the surgeries and the neuromodulators are another one. Unfortunately, most of the neuromodulators aren't going to give you the seizure freedom. They're really going to just reduce the frequency of seizures, but it's still another option that we have now for these patients on medications, because medications do have side effects, and sometimes those are the biggest detriment for patients who take the meds. They don't want to take them because of the side effects. So these kind of pacemaker devices can help them because they don't have as many side effects as the medications.
Well, the best of both of you in their practices, in this specific area of epilepsy, and Baptist Hospital covering a wide range all the way from Boca Raton over to the main campus in Kendall and in between. So a big area that the hospital is covering in this area to be able to help people all across the state of Florida. Thank you both. And this has been obviously a great conversation, incredible insight here with the two doctors for our audience. Be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. Thanks for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.